Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum. This is topic 7 in our course in patient safety, introduction to methods of quality improvement. Learning objectives of this session: explain science of quality improvement, differentiate between measurement for research and measurement for learning and process improvement, describe basic principles of quality improvement. Quality improvement in health refers to systematic effort to enhance patient outcomes, improve healthcare delivery, and increase the efficiency of healthcare system. It involves identifying areas of need. You need to know your gaps, implementing changes, and continuously assessing the effectiveness of these changes to ensure better performance and patient care. Research has shown that implementation of quality improvement, it improves patient outcome and it improves patient safety and satisfaction. It leads to better patient engagement. It improves communication along the organization, interprofessional communication, and patient and family and health provider communication. It increases staff satisfaction and retention, increase efficiency, compliance with regulation, cost saving, and it leads to sustainability. In this table, we would like to highlight the differences between measurement for research and measurement for quality improvement. The purpose in research, we would like to discover new knowledge, while in quality improvement, we want to see if we are implementing this knowledge. We need to know where do we stand in regard to this knowledge. In research, we use one large blind test. The gold standard is control randomized trial, while in quality improvement, we need sequential observable test. And in research, we have to control the bias, while in quality improvement, we just need to stabilize. Regarding data collection, in research, we gather a large amount of data. But here in quality improvement, we need enough representative data. The duration usually research takes a long time, while in quality, a small test of significant change, and this can accelerate the rate of improvement. The science of improvement. The science of improvement has its origin in the work of Edward Deming. He is recognized to be the father of improvement theory. He described 4 components of knowledge that underpin improvement. These are appreciation of a system, understanding of variation, the theory of knowledge, and psychology. Deming stated that we don't need to go in deep or in depth to know these in details. But he gave an analogy like you can drive a car without knowing how does it function. So basic knowledge can allow us to design improvement. The first component is the system. Healthcare delivery system is very complex. We have the patient with different illnesses, and the same illness can present in different ways. We have a lot of professionals. They have nurses, doctors, physiotherapists, dentists, pharmacists, and so on. And they interact with a lot of equipment and with environment and with organization culture. There are a lot of interdependencies and relationship. This makes the healthcare delivery system as a complex system. The second component is to understand variation. Variation is the difference between two or similar things, such as the different rate of success of appendectomy performed in 2 different regions or hospital or countries. In healthcare, there are a lot of variation about people performance and outcome of activities. The third component is the theory of knowledge. Deming says that the theory of knowledge requires us to predict what change we make will lead to better result. In order to make a good prediction, you need to be familiar about the place, about the people, and about the process and procedure. People familiar with these things can make good prediction. And the fourth component is about psychology. How do people react? Do they accept? Do they resist? How much resistance they do, and how we can convince them and persuade them to do the suggested changes. Basic change concept. Many of us intuitively use change concept in our life. The way we drive to different places, the way we make our coffee, the way we study. So always we try to improve by reflecting in our activities, learning from people surrounding us, or going into internet or any other literature. Change concept is a general idea with proven merit and sound scientific or logical foundation that can stimulate specific ideas for changes that will lead to improvement. These ideas can come from different sources: critical thinking about current system, creative thinking, observing the process, an idea from literature or from the patient or a family member, or an insight gained from completely different area or situation, like we see it in other industry and we try to implement it in our system. Improvement principles underpinning models for improvement. Quality improvement includes any process or tool aimed at reducing quality gap in systematic or organizational function. The basic principles of quality improvement are fairly intuitive. It should be patient focused. It requires strong leadership. All team members should be involved, especially those in the front line. We should use a process approach and system approach, and there should be a continuous improvement model. This is a model of quality improvement. It answers three questions. What are we trying to accomplish? How we will know that change is an improvement? What change can we make that will result in an improvement? The first question is, what are we trying to accomplish? This question helps healthcare team to focus on the area they are concerned and it requires improvement, and there is a gap and this area need to be fixed. Then all team members, they should agree that this problem need to be fixed. Example like high infection rate, poor scheduling for patient in the front desk, and we need to get supportive data to tell us that there is a problem. Then we will ask, how will we know that change has resulted in an improvement? As a healthcare provider, we need to measure the outcomes before and after the change, so that we can learn that the changes has resulted in a difference. The improvement can be confirmed when we collect data that the situation has improved over time, and we have to prove that this is a sustainable improvement. What change can we make that will result in an improvement? And this requires implementation of improvement cycle. This making a plan, doing it, study and act. PDSA. This involves the team testing different intervention. By making a plan, they do it, then they study the outcome and they make an action. The cycle begins with a plan and ends with an action. The study phase is designed to elicit new information and knowledge. This is an important step in improvement science because new information allow for better prediction about effective changes. Issues to consider when beginning an improvement project. The first step, we need to establish a team. The team should be made from people who are aware about the process and will be affected by the outcome. The team need to set aims and objectives. These objectives should be specific, measurable, achievable and time bound. And also the team has to establish how will they measure the change. And they need to select the change to be made. It should be relevant to the process, and we know that all improvement require change, but not all changes will lead to improvement. And after that, and after they implement the change, they need to test the changes, and then they need to implement. At the beginning, they implement the change in a small scale, and if it shows success, then they do it in large scale. So then it comes the implementation, and then it need to be spread all over the organization. Measurements are very crucial for quality improvement project. We do this measurement before, at the beginning, and after we implement changes to see there is improvement. These measures are outcome measures, process measures, and balancing measures. In outcome measures, we include frequency of adverse event, number of unexpected death, patient satisfaction survey, these to help us to define the outcome measures. In process measure, this refers to measurement of working of a system. These measures focus on the component of systems associated with particular negative outcome as opposed to incidence of this event. Some specific example like how frequently we complete swab count after surgery, measuring the delay of drug administration at the beginning of surgery. The third measurement is the balancing measures. Here we want to make sure that the change we implemented does not lead to additional problem. For example, if you want to reduce the hospital length of stay, you don't want the population to have increased rate of readmission. In this session, we are going to highlight two continuous improvement methods. One of them is clinical practice improvement methodology, CPI, and root cause analysis, RCA. In clinical practice improvement, the first step is to create a team. The team should be relevant to the project, and it should be made from people who are involved or will be affected by the change process. Having such people, it allows you to get intelligent and applicable suggestions, and it also facilitates their buy-in in the change process. The team can develop their mission and objective. It is very important they get relevant data, and they have to prioritize the problems on hand, and then they can brainstorm to make suggestions. So in short, the team identifies the problem, they measure the magnitude of the problem, then they prioritize which problem should address, and then they brainstorm to suggest solution and how they're going to implement them, and also they decide about the measurement they get after they implement the solution. Then it comes the intervention phase, after they decide what interventions they need to do, and there's a very intake cycle of plan, do, study, act, put cycle. The way we make the improvement is by implementing the cycles of plan, do, study, act. In the planning phase, the teams, they set their mission and objective, and during the brainstorming, they make prediction about what need to be done or implemented, and decide the change plan, by whom, what to do, when and where, and at the same time they need to plan data collection. Then they come for the implementation, they do it, they carry out the change in a small scale in case there is any troubleshooting, so they don't interfere with the whole workflow, and they document their observation, and at this time they can get a lot of feedback from people involved in the process. So then they have their data, and they come in the study phase, they compare the result with the prediction, and they see if there is a real and significant improvement in the process, or they need to make more brainstorming and more prediction. So then they come to the act phase, what change can be made for the next cycle. They have to adapt the change, and they run then another test, and they go on plan, do, study, act. In some projects, the team will run single test. But during this, they will run multiple cycles of plan, do, study, act. During the brainstorming, they hunch theory or idea, and then they make their plan, they do it, then they study the outcome, and then they act on that to make another plan. If the first cycle is successful, then they implement it, as we mentioned first, they start in small scale, and if it's successful, then they implement it in large scale, and then they fix it. But if there is no significant improvement, then they need to readjust their intervention, and they repeat the cycle till significant changes and significant improvement is achieved. In some project, you might need to run multiple tests, test 1, test 2, test 3, but it goes through the same methodology. But we want to make sure that each test does not interfere with the other, because they need to have a clean data at the end, so that to decide which interventions are very useful and successful. At the end, we will ask ourselves, did the interventions make any difference? The effect of all changes need to be measured, so that the change can be said to truly have made a difference. The goal is to introduce a change that results in sustained improvement. At the same time, the data showing the result of change are displayed using run chart or any appropriate statistical method. After you come out with successful interventions, this need to be part of the daily process. It should be part of the system. So these changes should be documented and should be part of the policy, procedure, protocol. You should train the staff about how to use them. At the same time, you need to standardize the process and the system activities, and you need to have a monitoring. That is, you have to measure the performance and to see if there is a deviation or not. Another tool of quality improvement is to conduct a root cause analysis. RCA is used after incidents to uncover the primary causes. It is a defined process that seeks to explore all of the possible contributing factors associated with the incident. What happened, why it happened, and what can be done to prevent it from happening again. And to do RCA, you need leadership and organizational support. VA developed a good model, and it is used by many hospitals. In this model, they assess communication, environment, equipment, other barriers, rules, and scheduling. In communication, it is very important to identify the patient and to transfer information between healthcare team, and also in environment, to make sure the environment is suitable for the function, and any environmental hazard should be assessed and eliminated. They should assess equipment, are they well designed for the purpose and the function, and if they have been checked. And they assess presence of barriers that prevent people from doing the right thing and enhance them to do the right thing. And also they assess presence of protocol, policy, procedures, and they assess the scheduling button, and if it look for the fatigue factor and distribution of work. Then from the RCA, after you assess all these factors, communication, environment, equipment, barriers, rules, and fatigue, you come up with recommendation. These recommendations should be specific, should be concrete, should be easily understood, and it should be realistic, and it can be implemented. And also they have to define who should do them and the time frame, and this become part of the new policies. To have successful clinical practice improvement or root cause analysis, we need to use some tools like flow chart, cause and effect diagram, fishbone, Pareto charts, and run chart. Many improvement projects, they start with flow chart of process. Here they map all the steps that involve in patient journey, from the first registration in the front desk, and then investigation, and so on till discharge time. Flowchart can help health care worker develop a shared understanding of the process and use this knowledge to collect data, identify problems, focused discussion and identify resources. This chart can serve as the basis for designing new ways to deliver healthcare. The healthcare worker who documents the process in question also gain better understanding of the role of each member involved in the process. Flowchart can be used to identify any steps that do not add value to the process, including delays, breakdown in communication, needless storage or transportation, unnecessary work or duplication, all this which can add extra expenses. Cause and effect diagram, also known as fishbone diagram or Ishikawa diagram. Cause and effect diagrams are used to explore and display all the possible causes of a certain effect. A cause and effect diagram graphically displays the relationship of the cause to the effect and to each other. It can be used to identify multiple factors that may contribute to the effect. This type of diagram can help a team focus on area of improvement. In this diagram is showing the effort of the team trying to reduce the length of hospital stay following colorectal surgery, and they divide they group the causes into complication, staff attitude, social issues, procedure, patient perception, and post-discharge. And in each of these categories there is multiple items. Another tool in quality improvement is use of Pareto chart. This is based on Pareto principle, which describes that few contributing factors account for most of the effects. This helps the team to focus on those few factors and to set their priority. Pareto diagram is a bar chart in which multiple factors that contribute to the overall effect are arranged in a descending order according to the relative magnitude of their effect. In our example of reducing the length of stay of postoperative colorectal surgery, they found that the three major factors are poor patient knowledge, non-standardized pain control, embedded staff attitude. If we focus on these three problems, we can help maybe up to 80% or more of the patient to have less length of stay. Run charts or time plots are graphs of data collected over time that can help the team determine whether a change has resulted in an improvement. Run chart will show the trend. A trend is formed when a series of consecutive points continuously fall or rise. Run chart will help the team to judge how particular process is performing and identify when change has resulted in true improvement. Take home: quality improvement methods and tools improve patient quality of care and reduces errors. Improvement projects depend on appreciation of a system, understanding variation, knowing theory of knowledge and psychology. In quality improvement, different measures are needed: process measure, outcome measures, and balancing measure. Plan, do, study, act are models of quality improvement. Team dynamics, leadership, patient engagement are very important for effective quality improvement project. Methods and tools for quality improvement need good teamwork and collaborative effort. Measurement of real improvement should be documented and sustained. Simplification, standardization, and governance through policy procedure will sustain the improvement.